Dr. Dery?
Yes.
Danny Babin. How you doing, sir?
All right. Mr. Danny, how are you?
Oh, good. I see I have a glare in my glasses there. Let me maybe turn a little bit.
All right. Good. Well, I was hoping to get you on at 4:30, but we got you on a lot sooner, so that's
No,
good.
that's fine. The lady just called me, so we put it on, and I said I just shouldn't leave it on. Okay.
All right. Well, that's good. I think joining us here is going to be Doc Griggs in a second as we get the show going.
Great.
Eric, are you on? There it is. That's Doc Griggs.
Rocking and rolling right here.
All right.
How are you, sir?
That's Council Member Babin from Terrebonne.
Pleasure to meet you, sir.
Same here, sir.
So what we're going to do, council members, we're going to just go through. We got you on right now. So Doc Griggs and I are going to go through we're going to present some information. And now that you're with us here, you're welcome to join us and enjoy the show with us. So thank you.
We love your input. This is the fun part of the show. Remember that. This is the fun part of the show.
Good. I'm looking forward to it.
Councilman, I'm gonna warn you now. He's a little sensitive sometimes, so just bear with him, okay? Just tell him he's doing a good job, okay?
Well, I think he knows my life. I think he knows my life history already from the 2 conversations we had on the telephone.
There you go. So welcome to the show, everybody who's tuned in. My name is Dr. Dery. That's Doc Griggs, and it's a pleasure to have with us Council Member Danny Babin, who is a City Council member of Terrebonne Parish. And we wanted him to join us for the show today because Terrebonne Parish did something really cool last night that I really wanted to highlight, and something that's near and dear to my heart. And that was prior to starting their meeting, which they had online via Zoom, they did it, they all wore masks. And so I think the idea of wearing masks is something that's incredibly important. And
yes, they are, Councilman. Yes, they are.
Yes.
Who that? Who that?
I need to walk and get mine.
Yeah, I don't know where. Here we go. This one was made by a fan of the Rolling Elvi, and so she sent this one. But you can see, yeah, I've got Dumbo ears. I got Griggs ears. They just stick out like.
Yeah. That's a compliment. That's a compliment.
There you go.
There it is.
I went out to my Jeep because I have 400 of them in my Jeep.
Awesome.
All right. Well,
I try to pass them out everywhere I go when I see people without them.
I love it.
That's awesome. Good. Well, let's get the show started here. Somebody just tried calling me, so we're gonna first go. The first thing that we usually do, council member, is that we just go over all of the epidemiology. So you're gonna get a quick little lesson in epidemiology very quickly here, and so let's do that. So real quickly here, what we're seeing here is that in the global cases, we're about 4.5 million people who've now tested positive globally around the world for COVID, and about a total number of over 300,000 deaths. We knew that number was going to be coming up on us very soon, and here it is. Overnight, there was a whopping 81,000 new cases that was diagnosed. So we're going to see that New York Times curve tomorrow go up. And then the same number about deaths that happen every day. Globally, there's about roughly 4,500 to about 5,000 new deaths that are added daily. And as you can see, this works out to about 3 people who die per minute, which is really outstanding or astounding, and still quite shocking to me that we suffer so many deaths. If we do this show for an hour, there will be 180 people that will die in that 60 minutes. Here you can see the number when we see the epi curve globally. You can see the epi curve is more or less stable. I think that we just have reached a plateau again. Once we start seeing more testing in the resource poor part of the world, particularly South America, Central America, and Africa. I think that we're going to start seeing increases in numbers.
So Dr. Dery, can I make a point here?
Yes, please.
We're using the term plateau, and when we use the term plateau and we come locally, we talk about things stabilizing and leveling off or flattening the curve. I need people to understand that this curve has flattened at the top and not gone down. That means we're getting to a point where it rose and it's staying here. We're at the point now where it's stabilized to the point that 3 people per minute are dying in the world right now. 3 people per minute. That's the up part of the curve. That's not you flattened it and it stabilized to 180 people in an hour will die from one thing. So it's not necessarily something to hang your hat on and get comfortable with. This is at the top that it's the plateau. It's like climbing to the top of the mountain and seeing that it's flat up there. Yeah. Hopefully there won't be another mountain and we'll start to see the other side to go down at some point. Sorry about that.
I think very, very well said, Doc Griggs, and I agree with you, and I hope that time comes obviously sooner than later. We started to see, as we said, this is the total death curve. The curve does appear somewhat to be decreasing. You see we've had an uptick in extra cases here. I anticipate that, as we said, there was more cases, there was more deaths. So this mortality rate is going to start kind of the line is going to probably just start kind of going like this. So you can see it is trending downward. And I think that's good, of course. I think that this is as we're getting better with understanding how to test earlier, how to initiate treatment earlier. When I went to Sierra Leone to do the Ebola epidemic, we saw the same thing, that there was these very, very high mortality rates initially, but then as we proceeded through the process of diagnosis and treatment, we got better with treating people. We got better with diagnosing earlier so we can initiate treatment earlier. And we saw that our mortality rates increased significantly. Our mortality rates, our ability to decrease the mortality rates got a lot better over time. In other words, their survival rates were much better over time. When you look at the US, we are just blowing away. We're up to 1,450,000 cases. We're going to be hitting 2 million cases probably sooner than later, which is really, it's still somewhat stressing. Usually we add about 15,000 cases per day. So we added 20,000, which is a huge jump for us, which is why this number is a lot bigger. And if this number continues the way it is, we will be approaching 2 million cases, unfortunately sooner than later. The number of deaths is more or less stable at about 1,400. And again, this works out to be about 1 death per minute. So again, from the start of this show to the end of it, we're going to have 60 people just in the US die. The other notable thing that we'll talk about too is that the globe has 3 deaths per minute and the US has 1 death per minute. That means that we account for 33% or 1/3 of all mortality in the world. And the important thing to recognize there is that we are only 5% of the total global population. And to me, what this speaks to is that we just need, we need to do better. We can do better. And again, I think that a criticism that's common here is that there's just been a huge lack of central coordination on a federal level, which has really kept us behind. And there's one thing that we could do to make everything better is everybody wore a mask, but we'll get to that in a second. But again, I just want you to notice the number of deaths. We're about 86,000 deaths. And I like to show this slide. We talk about being at a war with this enemy. These are the number of US military deaths. Of course, other civilians died in these wars as well, but the Korean War was 54,000, Vietnam was 58,000, and World War I was 116,000. And you can see with our death rate of about 86,000, we're very, very rapidly approaching those World War I levels, which is not a milestone that I will be happy to see if and when we get there. The number of US cases does appear, at least here. It looked like it had been falling for some time. It does appear to be falling a little bit. Again, with the number of cases we saw yesterday, we are going to see an increase in this line. Again, the New York Times the New York Times slide is 1 day behind the Worldometer slide. So you're going to see an increase here tomorrow. Our death rates, you can see that it would look like it was trending downward, and it does appear to be going upward. I'm wondering why the chart makers decided to go with a downward slope here, unless what they're doing is they're reflecting this period here instead of kind of, you know, continuing straight. So I don't know how they, again, remember there's some error on either side of these bars, and so I don't know how they make that decision, but it's certainly interesting that they decided to kind of, you know, go down on that. I again suspect tomorrow that's going to go up. This is the number of testing globally. Iceland has the most number of tests here at about 163,000 tests per million people. Iceland is really the paragon of the folks that are really doing the best in terms of management. You can see here the total number of deaths have been 10. This is really incredible. I went to Iceland 2 years ago, and you can understand the country is so deeply organized and very, very highly functional. You can see here the U.S. is at about 31,000, almost 32,000 per 1 million. So this definitely accounts for why we have such high number of cases here, as well as a high number of deaths. Some folks think that we should be doing about 2 million, given our numbers, we should do about 2 million tests a day. And I think that if I remember correctly, maybe the council member can remind me, but I think that the governor, Edwards, had talked about possibly aiming to do 200,000 tests a day just in Louisiana, right? That was the goal, 200,000 tests?
200,000 is what I remember, yes.
So you could see we still have some work to do. This is looking at the total number of tests that have happened in the U.S. total is about almost 10 million. And if you think about, we should be at 2 million tests a day to get this virus under control. You know, that's already, what is that, 20%? Yes, 20% of the total that we've done already over 3 months, right? So we definitely have a lot more work to do. But when you take this number, the number of positives, and divide it by the total number of tests, you get a positivity rate of 14%. And that number should actually be less than 5%. So that means that we're still testing people who appear positive to us. And we refer to that as a pre-test probability. And what should be happening is, we know that we're testing the right amount of the population if we are testing, if our positivity rate is under 5%. When we look at Louisiana, we're about almost 34,000 cases with about 2,400 deaths. You can see Jefferson Parish and Orleans Parish with the total number of cases, as you can see, or the most number of cases, and with also the most number of deaths as well. When you look at Louisiana in terms of case rates, we are 1, 2, 3, 4, 5, 6, 7, 8. So we're 8th still. So our case rates are about 7,200 per million people. So we used to be number 1 on this list. Okay. So we were number 1, then we were number 2, we were number 3, and we've slowly been falling. Ultimately, we're number 8. So that's good. Our mortality rate is still quite high, 1, 2, 3, 4, 5. So when you look at our total number of deaths, we're about 520 deaths per 1 million population. Again, as I point out every show, these states are notable right here for all being clustered together, right? They're also highly dense and packed states where people live very, very close to one another, all in the Northeast. And you could see the first one on the list that's not in the Northeast is in Louisiana. And that to me is, again, something that we talk about on this show pretty regularly, is overwhelmingly the reason for this is due to the social determinants of health. We have a more poorer population. We have a bit of a sicker population, largely due to the diseases of poverty, And this is why we're also seeing these cases disproportionately impact communities of color and those that are the lower socioeconomic scale. The Louisiana testing rates, we test about 53,000 per million people. So 1, 2, 3, 4, 5, 6. So we're sixth in the country. We were number 3 for a really long time, but a lot of these states have really kind of have pushed in front of us. So that means that they've done a great job as well. When you look at our numbers here, you can see we had an uptick yesterday that we predicted. Because there was an increase in cases, but you can see also, I don't know if you saw also, I saw Governor Edwards today say that there was some new 833 cases that were reported yesterday that were going to be reported today because they were quote unquote lost tests. So I suspect that we're going to see an increase in numbers as well. And our mortality rate, when you look at Louisiana, again, I think it's somewhat trending downward. And again, these are good signs. With us opening up the state, however, I am concerned for a potential trend upward, which of course would mean about 5 or 6 days later, this trend in the mortality curve will be going up as well. This is looking at Brazil. I use Brazil as an example of a country that's not unlike how US is managing their COVID cases, and their COVID cases are largely due to just let's not do anything from a centralized perspective. And I just show how the cases in Brazil just continue to get higher. You can see here, this is their highest number of new cases were reported yesterday. And when you look at the mortality rate, yesterday was their highest mortality rate. You can see this is their third highest mortality rate. So the people in Brazil, especially those people that live in what are referred to as a favela, which are the poorest part of the country. These are what we refer to as slums, if we see a resource poor country, are suffering the most from that. This is the Orleans Parish just dashboard. You could see total number of cases statewide, these are the total number of cases statewide. This is the total number of cases in Orleans Parish. This is a total number of deaths, total number of tests. And so if we just go in real quickly, you can still see cases are increasing in the state. With Orleans Parish, it's remained fairly stable. Total number of deaths continue to rise within Orleans Parish. Again, that's remained stable. And total number of testing has increased again, and you can see in Orleans Parish, it's slowly starting to increase as well. Lastly, checking on our ventilators. We still have plenty of ventilators. So for the folks that are going to be going out this weekend, which I understand is going to be plenty, recognize that you're going to be very lucky. We do have ICU beds available. We do have ventilators available. We do have, the hospital beds are starting to pick up a little bit. So I would, of course, strongly encourage you to not go out so that we don't see you on a ventilator or an ICU bed. But of course, people will make their decisions as they will. And with that comes to the end. These are our hot topics that we'll talk about in a second. But that comes to the end of our presentation. So I just wanted to turn, before we get to you, Councilmember Babin, I was going to turn it over to Dr. Griggs, and any quick words?
Yeah, so first I want you to go back to slide 7. I
All right.
wrote down some stuff that I want to emphasize.
Was it this one or
yeah,
my
slide?
slide?
I want to start here. I want people to understand that we're encouraging people to do more testing, and I'm going to get to that point in a minute. If you do more testing, you will get more positive tests. Not necessarily positive, more deaths, but you will get more positive tests. Why? Because as you test more people, and our goal the city of Wuhan now, just read an article that came out today that Wuhan is going to test everyone in all 11 million people. What that does is it helps us predict the behavior of the virus and see what it's done. And it also helps us get the characteristics of the virus as it's asymptomatic. Up to 50% of the people that are infected with the virus have no symptoms, but they're still able to spread it to someone else who could potentially end up in the hospital on a ventilator and die. I said that as using one of Dr. Dery's corny transitions because I want to talk about deaths. The number, and if we can go to slide 11, please.
My slide 11 is different from what you consider slide 11.
Well, I'm looking at slide, go back up. This tests the total number we're looking at the number of new deaths. The reason I wanted people to pay attention, there's a lot tied into the number of tests per day. We're all aspiring to be able to test more people, and that capability has evolved, and we've actually not only witnessed it, but been a part of it. First, there were not enough tests available to test just the people that were getting sick, and happened that we have a high percentage of positive tests in those cases because we were testing the sickest that came in with symptoms. Now we're moving out to more of the surveillance and the discovery phase of scientific process. We want to test as many people as we possibly can. So that process of testing is dependent on the evolution of testing, the availability of supplies, and up to this point, it's been the trained personnel to properly do the testing so we can get consistent numbers. Well, now we're evolving. We're evolving. You've heard about the PCR, the nasal swab test. The new term now coming up, the FDA just gave an emergency use authorization for a type of test called an antigen test. You are familiar with it. If you've ever had a rapid strep throat test, a strep test, or an influenza test in an office where they get to, it's a nasal swab right now, and they're trying to evolve it to a spit or saliva swab where they can actually test it, and you put the drop and you wait for it to the results within 15 to 30 minutes. It's point of care, and they can mass produce it, and it doesn't need to have special training. These are tests specifically for the virus. Now, if we can go back real quick, Doc, that's a lot. You're hearing a lot about testing. There's antibody testing. I just told you about antigen testing. Well, PCR and all this stuff, that's confusing. The stat that I want you to look at, and Councilman Danny, I really, this is the one that everyone should pay attention to because we all understand it. And it's very simple. It's white and black. It's the death stat. You want to pay attention to the death curve, the number of deaths. As you see, the percentage and all of that will be watered down as we track and are able to test more people. We might find people that are asymptomatic that can make that mortality, which is the same as death, number go up or down. But we do know that for people that are not with us anymore, these numbers all represent, in the death column, represent a person. You can easily track. If the epidemiology is too much, you can track it with your mind and your brain, or you can track it, if you're tracking it like I am, with family members and friends that I know, with death. The more that we're able to stay at home, testing is tied to contact sourcing, which means test, trace, isolate, which means that we're taking the people that are positive and can potentially spread this virus to other people that could potentially lead them to death. We're taking them out and can quarantine them. That's what Doc means, that if we're able to test, get enough testing done with mask wearing, we can get ahead of this thing and get control of it. That's how testing is linked to control of the virus. And the stat we should be really paying attention to, if all of this epidemiology is a little much, pay attention to the death rates and death. The deaths follow the number of cases, but it's easy. Every day, if you wait for us to talk about deaths, everything else will fall into place and fall into context, I'll say. Doc?
Yeah, absolutely. Thank you. Those are obviously sage words as every show. Councilmember Babin, as we just, and again, if you guys are tuned in, thank you for tuning in. This is the Dr. Dery and Doc Griggs live show, Noise Filter. We also have a daily podcast called Noise Filter. You can find that on all your podcasting sites and platforms. You can also find us at noisefiltershow.com. It's a 10-minute, high-yield, bite-sized, chunked information. With us today we're very pleased to have a City Council member, Danny Babin, with us, who is the City Council member from Terrebonne Parish. And yesterday, Terrebonne Parish wore masks while they were having their City Council meeting on Zoom. I thought that was so cool. We decided to ask Councilmember Babin on the show just to join us and chat with us. So, Councilmember Babin, we went over a lot of numbers and stats, but was there anything there that left an impression on you, or was there something you wanted to chat about?
Well, just the fact that when you start off saying 3 people every minute are dying in the world and 1/3 of them are here in the United States, that's scary to me. Uh, I'm not a scientist, I'm not a doctor, and I'm just a layperson and a politician, if you will. And anytime 1/3 of anything is a lot, especially when you're talking about a pandemic and
Sure.
the numbers of people that we're talking about here.
Yeah,
That's the
absolutely.
thing I think that stuck out most with me.
Right. Yeah. No, I think that point is well taken, and in fact, that's why I show it like that is to drive that point home. We also have a quarter of the total number of cases as well around the world. We have about 1/3 of the deaths, and again, we are a minority in terms of what our total population is in the globe. And we're going to talk about this in a little while, but you saw today Dr. Bright, who was the physician who was fired from his position at the NIH. He was in charge of making vaccines. Had some very strong criticisms today, talking about the U.S. Now undergoing the darkest winter, were his words, and that's largely due to just an element of not being prepared and not watching and reading the tea leaves appropriately as this virus was coming down the line. And now, as you said, Councilmember, it's to a large degree very scary to watch these numbers and we've been doing this now for a couple of weeks. And we just keep seeing these numbers just keep marching upward. At one point we were well before the Vietnam. We were at mortalities when we started. It was death rates were like 15,000 or 20,000 at that point. And I was like, oh, there's no way we're going to be reaching the level of the number of people who died during Vietnam. And we just slammed right past it. Getting to the numbers of World War I was like, there's no way we're going to do that. And I'm afraid that we're going to be, more rapidly reaching that number than I feel comfortable saying. So, but yeah. With that being said, anything else you want to jump to stories or?
Well, yeah, no, I'd like to tell the people Terrebonne Parish is a parish of about 115,000 people. We're about 50 miles south of New Orleans, for those that don't know. And our parish president and our parish council have been very proactive with the mask situation. We have passed out 150,000 masks in Terrebonne Parish, free of charge to the citizens. We've done it through our fire departments, through our police departments, the big box stores like the Lowe's and the supermarkets and Home Depots, and it's in the churches. We've passed. Actually, what we've done this past week, now that churches are going to be able to open again on a limited basis, we made sure that every church in Terrebonne Parish got a care package, if you will. It had disinfectant, a couple of gallons of disinfectant, some hand sanitizers, some gloves, some masks, and each church received a package of that. If they could not come get it, we brought it to them. So in Terrebonne Parish, we believe strongly in the mask. Is it going to be difficult to get people to wear them? Yes, it is. You know that. We all have a tendency to just want to take things for granted. I had to go to the store myself today with my mask on, but I keep about 400 masks in my Jeep. And as I was in there, and they come in packs of 10, as you know, as I was in there, I gave away 40 masks while I was in the store. It's sometimes a little uncomfortable to ask somebody if they want a mask if they don't have one on, because you don't know their circumstances. But I have not had anyone deny or turn me down by giving them a mask.
That's great.
So hopefully it'll catch on.
When did you first start seeing your cases? Were you starting to see cases in Orleans Parish? And did that give you time to start preparing, or how did you guys first start handling cases?
To be perfectly honest, we saw what was happening in New Orleans, okay? And then I think everybody just jumped on board at that particular time. And that goes back to, I'm early March, I would guess, is when I'm looking at my calendar. I would think it was early March that we started doing started slowing down here in terms of trying to slow the economy down and slow the population down from getting out.
And where we are now, could you have imagined this ever when things first started?
No, this is very hard to fathom. All right, to be perfectly honest, in our lifetime, I like to refer to the United States sometimes as we're a throwaway country. We everything is we want it at our fingertips and we want it immediately, and then we just discard things. And I think that's what's happened to a lot of people. They don't realize the severity of this. Okay. As you and I spoke before, we won't get into it very much. I did have the virus. It's been 45 days since I've had a symptom or I've had fever. And I can tell you in the 6 days that I did have it, and I didn't find out until 2 days after it was over that I tested positive, but it was real. And I was fortunate. I didn't have any respiratory problems with it, but the fever and the aching and the chills were unbelievable for 5 or 6 days. So those that had the respiratory problems, I can imagine how scary it was for them.
Yeah.
So with that said, I want you to, for those that are viewing, to understand. First of all, I want them to understand that you had a mild case, and anything leading up to being hospitalized, which would include the respiratory symptoms, would be a mild case. But when you say it was real, I want you to verbalize what you felt like. Like you keep reading that, it doesn't necessarily feel like with the flu, you can feel yourself kind of getting better and know that you're going to be back into shape. You'll be back to close to normal after a few days. What was the difference between what you felt and like any other illness you had before for those 6 days?
Well, just to let you know the symptoms I had, it started off with lower back and legs just aching. I could not get in a comfortable position. And then the fever started. And my fever never went over about 100.6, 100.8. But I bet you it's been 25 years since I had fever. So it knocked me down pretty hard. I did lose my sense of taste. And then the chills, I literally would have to take a heating pad sometimes just to keep myself warm. And for those 6 days with the fever, I literally thought about and did explain to my wife about life insurance and different things that we had here. It was that scary because I have a pre-existing condition, something that happened 25 years ago, but still, because I had that, and I'm going to be 72 years old this year, so I fit pre-existing in that age group. So a lot of factors. And male, correct. All right. So I took it very seriously. But what was amazing was when the fever broke, within 2 hours, I felt like I never had anything.
Wow.
I know, it's amazing, huh?
Wow.
That happened on a Friday night, and my family doctor called me on the Sunday night to tell me that I tested positive.
That was when it was still taking a really long time to get the test results.
Correct. It actually took it was 7 days.
Right.
So how did your message? So you had started. That's 45 days. Was this before you had started your campaign, or was this after? Did the campaign start afterwards?
The campaign started right around the same time, to be perfectly honest.
So how much more intense was your passion for your purpose after you had come through it?
Oh, you can't even multiply that high. Okay. No, it's unbelievable. I don't go anywhere without a mask on. I'm not telling you I wear gloves all the time, but I do have. Don't wear gloves?
No, we're glad you don't. I mean, it's
okay.
Dr. Dery is an infectious disease doctor. I do community medicine. If the infectious disease doctor, I tell him all the time, if he eats a piece of gum, I want some. If he has a cough drop, give me one. If he's going in the right side of the pole, where are you going? I'm following you. I'm doing exactly what he does. They don't wear gloves. And Doc, you want to tell them why? I mean,
yeah, I mean, the gloves are they're superfluous. I encourage people to wash hands more than anything else. I mean, gloves are fine. One of the issues with gloves is that we're seeing them thrown all over the place now.
Yeah, litter.
And it has become an issue. I encourage people to have something like this around, if possible, which are hand sanitizers. and just hand washing, more than anything else. But that, I mean, gloves are fine. It just, some people just gives a false sense of assurance. But the most important thing is, again, is the wearing of the mask, and that's so important. So, council members, so you guys, when did you guys start moving to Zoom meetings? Once the stay-at-home order was given by Governor Edwards?
Correct. We meet every other week. So we've had 3 Zoom meetings so far, and actually one of them was a 3-week period in between. So it's been for, I guess 6, 7, 8, 9 weeks now that we've been doing it that way. And we will continue. Our next meeting is not until the 27th of this month, but I think we're going to do it on Zoom as well.
Had you ever used Zoom before?
Only once, okay? And it's not like being in a meeting. It's very difficult to have a good conversation or a good debate, if you will, on a particular issue. What we're trying to do in Terrebonne Parish right now is not get into things that we don't need to get into right now. Basically, just to keep the government running is what we're trying to handle at this particular time. Because it's too hard to try to overload when you're doing it on the Zoom.
I would imagine, right.
Yeah.
And has City Hall been open this whole time, but limited access, or?
Well, actually, it's not open to the public anymore. And our employees, what we do here in Terrebonne Parish is they work 4 days a week now rather than 5, because every Friday, Saturday, and Sunday, all of our government buildings are sanitized. We have a company that comes in and completely sanitizes everything. Mm-hmm. So we just tried to take a proactive approach here in Terrebonne Parish and what our message was to people last night with the mask. We actually didn't wear the mask throughout the whole meeting, but at the beginning of it, we did like a commercial, if you will. It'll be on Facebook and YouTube. We all had a part in it, and then we put our mask on and said, just mask up. And our point is that the mask helps the other person. The other person is helping you. So think about that other person.
That's exactly right. And I'm getting to the point now where if somebody's not wearing a mask when I walk by them or whatever, I find myself getting a little frustrated. Like, why aren't you wearing a mask? Haven't you heard the message yet?
But I like the councilman's recommendation. He gives them a mask.
Right. That's right.
Yeah. Well, there's the medical side, and then there's the political side. You don't want to push the issue too much to get people aggravated, and then you might have some civil unrest. I mean, that may be a stretch, but I guess a lot of people's temperatures are a little bit high right now, and I don't mean from a sickness, just from having to stay home and being isolated. So we don't want to inflame anything.
Sure. And there was the case where a security guard did ask somebody to wear a mask when they entered a business, and apparently somebody came back and the guy got so angry he left. Unfortunately, took matters in his hands, which ended in a very tragic way. Of course, we don't want that to happen, but it's my supposition that if everybody wore masks for 30 days, if the whole globe wore masks for 30 days, we would stop the transmission of the virus, at the source, from projecting outward. It'd be wonderful to see Louisiana embrace, if we could do something at the statewide level where everybody would just be wearing masks. I know in Orleans Parish, as the mayor and the health department are getting ready to reopen, I know that they are, my understanding is that they can't mandate the use of masks, and I don't quite understand, and maybe Councilmember Babin, you could help us understand why a mandate is not possible, because I keep being told, why are we not mandating these? But they're strongly encouraged, and I'm seeing other states that are mandating. We're seeing countries like the Czech Republic, which is strongly mandating as well. And of course, when you look at the Asian countries, Thailand and South Korea and Japan, countries that have very strong face mask wearing cultures, their death rates are very, very low. So to me, the mask seems like the ideal method. And if we all did it all at once for 1 month, let's say, we wouldn't have to wait for the vaccine, because this is going to be our new life now until a vaccine comes or something else. And that something else, that other intervention, I would argue is mask. So Councilmember Babin, why is it hard to mandate something like that?
Well, when you mandate something, you have to be able to back it up with some type of force of law. Do we want to get to that point where we have masked police going out there to arrest or give someone a ticket for not wearing a mask? I don't think so. So, the word mandate comes with a lot of strings attached to it. But if you keep using the term strongly encourage to wear, and you may throw in the word mandate, but it's not written in stone. It's not an ordinance or a bill or law. I think what will happen is when you try to mandate something, there's always going to be another group who is going to fight that. And then they're going to go to a judge and get a temporary restraining order saying that you don't have to wear a mask. So it may be counterproductive to try to mandate something. I think we just keep sending that message. Let's strongly encourage everyone to wear a mask and let them know that you are helping the other person when you do it, and they in turn are helping you when they do it.
So Doc, at this point, if you could pull up and find that demonstration that you showed me, that I'd like for the councilman, I really want you to see this. If you want, you say we got the doctor stuff covered for you, but we want to give you some ammo that you can. I'd love to hear your explanation of how we should transmit this message after Doc shows it to you.
Great. And before you do, I just wanted to ask the council member one quick question. Let's just say that they were to take something like this to the judge. Wouldn't the judge weigh out is personal rights like more important than, if we know that masks save lives, wouldn't a judge place more weight on the lives of the citizens than the personal rights of a citizen?
Well, I would hope so. But as well as I do that not everyone thinks maybe like we're thinking right now. All right. And I hate to say there's good judges and bad judges, but there's good counsel people and bad counsel people. So we have free will, and I think some of them would see it in the opposite direction.
Sure. And then right here, I just want you to know that you're talking to a good doctor and a bad doctor, and we'll just leave it to you to decide which one is which.
Well, look, I like to play good cop and bad cop myself.
I have no idea what he means by that. I know one doc has very strong antibodies and very strong, everything is evidence-based, and is trying to prop the other doctor up to shine. And it's called, you know what it's called? It's called EQ. He skipped that class in med school. I was there. I passed it.
All right. Councilmember, what Doc Griggs wants me to show you is this amazing experiment that happened in a dark lab. Okay. So what you're going to see when I hit play, you're going to see somebody speaking, and they're located in the center of the screen right here. You can't see them, but you're going to see the contents come out of their mouth. Okay. And they're not wearing a mask in this case. Okay. And I just want you to just focus on this part right here.
Now I'm recording. Stay healthy.
Unbelievable.
Stay healthy. Great. Less loud. Stay healthy. Good. Are you recording? Yep. Stay healthy. Louder. Stay healthy. Louder. Stay healthy. Nothing.
What do you think about that? That's pretty.
There's a marked difference between the two, isn't there?
That's
that Doc, where did that come from again?
It came from the New England Journal of Medicine. If I ever had an
councilman, is that scientific? No, go ahead.
I think it's scientific enough. Yes, sir.
I was gonna have to back up your evidence.
I was going to say
very much so.
I'm happy to go to that judge and show them that that video. Now, as you know, we've talked. Obviously, I've told you about my wife, and she says obviously the same thing, that it's just impossible to enforce, and that seems to be the snafu. When I had talked to, I'm not sure if you're familiar with Judge Calvin Johnson, who's a local, was a federal judge here in Orleans Parish for several decades. He reminds me, and I will be having him on the show, if not this week, probably next week, that he was telling me that the law bends in favor of prophylaxis. In other words, of prevention more than anything else. And so I'm not a law scholar, and I know that you're a businessman, and certainly Dr. Griggs is a physician, as I am. So we don't know the intricacies of the law, but to me, it just seems that we're going to be stuck in a quagmire for several years, possibly, until a vaccine. And it just seems like the economy is at a standstill. Certainly, lives are potentially at a could potentially continue to be lost. And this, everybody has access to cloth and clothes. You could just take an old rag and do it. So no matter where you are in the world, people would have access to something like that. So this is the soapbox that I have a feeling I'm going to be on probably for quite some time. So I don't want to belabor the point, because
I think it's a good soapbox. Okay.
Yes.
And I think it's one that we all need to get on, to be perfectly honest. And again, I've mentioned some numbers earlier. We have 115,000 people in Terrebonne Parish. We gave out 150,000 masks because we wanted everyone to not be able to say after it was over, well, I didn't get a mask. No, you had an opportunity to get a mask. We gave out more than the population of the parish. So if you don't have one, you didn't try to get one, you threw it away, or you just choose not to wear one.
Right. Well, absolutely.
And that's the political side. Okay.
Right. I was just actually, I'm going to try to get to the Terrebonne Parish numbers here in a second so we can see the numbers. But I saw that it was fairly far down the list of the total number of cases in the state.
It seems like today I got an email while we were on. I think we're at 550 positive cases, 42 deaths.
That's right. Let's see. I've got it right here. 550 cases. That's right. Overnight, there was 8 new cases. What I have here is 41 deaths, and overnight there was 2 deaths that were reported, and the total number of tests have been a little bit more than 46.
Yeah, it's showing 41, but I can tell you, we go through the coroner here, and I happen to be talking to EOC person just a while ago, and the coroner verified there was 1 more death. So it'll show up tomorrow, actually.
That's right.
But we've seen an increase in cases and in deaths from nursing homes here in Terrebonne Parish.
Oh, right. So can you talk a little bit about that, about the cluster of cases that you have seen in the nursing homes? We don't have to obviously name the nursing homes, I know.
No.
But
what's happened, we've had 2 clusters to show up here in the last couple of weeks. We had 40-something people in jail test positive, but that was 40, I think it was 41, if I'm not mistaken, out of 525 people. And then we were able to isolate them, and that has gone down now. But the nursing homes, just to give you some figures, today in Terrebonne Parish, I think there's 22 people in the hospital and 4 on ventilators. Out to 22 people, I want to say 17 or 18 of them are from nursing homes, and 3 out of 4 on ventilators are from nursing homes. And it's not just one nursing home; it's pretty much spread out between the entire. We have about, I want to say, memory serves me, around 500 people in the community in nursing homes.
Wow. Okay, so that's a significant portion for a parish, a little bit more.
And my numbers may be a little off now. You can't quote me on those numbers, but it's pretty high.
Yeah. And so has there been any evaluation? I know what the answer is of why it's the case. It's very hard. Nursing homes are by definition very, very difficult places to maintain. People are clustered together. if you have people who are particularly old, not unlike those that are particularly young, they may not have 100% sense of their faculties and may fail to recognize social distancing. Nursing homes are a very, very difficult part of this experience. And Doc Griggs and I had, at the very beginning of this, when Doc Griggs and I first started reporting on this in early March, had identified nursing homes as a place to watch, as we had felt that, given the difficulties of nursing homes, that they would be pockets of cases. We'd find clusters of cases, and I think, unfortunately, that prediction has come true. Have you guys? Has there been any way? I know that you said in the prisons you were able to do some isolation, and I do want to ask you about prisons in a second. But were you able to do anything like that in the nursing homes, or do you guys have a standardized program to like check everybody in the nursing home once a week, or how has the parish responded to the nursing home outbreaks?
Well, our emergency preparedness department basically handles all those things. As a councilman, I'm not directly involved in that. Each day we have a conference call at 10 o'clock with the parish president, Gordy Dove, and the 9 council members and EOC. And he conducts the meeting, gives us figures, okay, of what's going on. And over the last week or so, he's been talking about how the health department is checking more, if you will, on the nursing homes to make sure everything is as it is supposed to be. And I think everything has. It alludes back to what you said. We have some people that are now getting mentally challenged in the nursing homes. It's hard for them to keep the social distancing, to keep a mask on. It's unfortunate. Here in Terrebonne Parish, out of the 42 deaths, the average age is 78 years old. By the way, the youngest we had was 62 and the oldest was 98.
Boy, oh boy. And how are you able to, one of the other pockets of clusters that we were concerned about as well was was in the carceral system. How and that again may not be your forte, but was there a way that the parish was able to make sure that the prisoners were safe and isolated?
We're fortunate the way our jail, if you will, is configured here. It radiates from the center as legs go out like a starfish. So we were able to move prisoners to 4 different wings and isolate the sick patients, if you will, in one wing of the jail. Had it completely sanitized and then moved those prisoners in there.
That's great. Yeah, that's great. And now moving forward, we are starting to do the state is starting to reopen, and I assume that the parish will be opening up as well. So our final question for you, Councilmember Babin, is how is the parish getting ready to reopen and yet at the same time maintain a sense of safety for its citizens?
Well, we're trying to do it, and we do a program on, we have a local television station here, HTV, and we have 2 newspapers. One is just an online, and the other is a written paper. We continually do public service updates on them on Facebook. Each one of us council people have Facebook accounts. So does the parish president. So does the government itself. So we're trying to disseminate that information out. Unlike New Orleans, where you have all of these television stations where you can get that information disseminated, it's a little bit difficult in a more rural area like we are. Houma is the only city in Terrebonne Parish, okay? Right. We have 5 bayous that radiate down from here, and I actually represent 3 of those 5. And I'm not saying that we're backwards by any stretch of the imagination, but we just don't have the television stations to get that information out. So we do it, and we've had a lot of good local participation in the community. The big box stores, if you will, have been very good at working with government to have hand sanitizers outside, to have someone at all of them spraying the buggies. before people go in. Everybody in the stores are wearing masks. A deputy, if they're on a detail, but they're in a Terrebonne Parish Sheriff's Department or Homeland Police Department uniform, they wear a mask while they're in there because it's a public, you're out in the public and you want to show that if we're doing it, maybe you ought to be doing it as well.
That's great. We definitely need to start wrapping up the show. Councilmember Babin, thank you so much. Do you have any final words for us or any final words for folks that are watching?
Well, I'll do like we did last night on Zoom. Mask up.
That's right here. Yeah, it's,
there we go. There we go. That's look. Let me get mine on here.
Where you got?
I like that. I like that. Who dat one now? Okay.
Yeah.
Who dat? Mask up.
Any final words, Doc Griggs?
Mask up. Who dat?
Mask. Councilmember Babin, thank you so much. It's such a pleasure. Hopefully, we would love to have you back on at some point in the near future.
Anytime. Thank you all very much, doctors.
Thank you.
Very much a pleasure.
All righty. You take care.
Bye-bye.
Bye-bye.